Growth hormone. Children do not always grow at the same rate. There are many things that affect growth, including genetic makeup, chronic illness, nutrition, and hormones, the natural chemical messengers that tell other parts of the body what to do. Growth hormone is produced by the pituitary gland, which lies at the base of the brain and is sometimes called the master gland because it influences so many other glands in the body. Growth hormone is secreted from the pituitary into the blood in bursts several times during the day and night. Growth hormone deficiency is a pituitary disorder that affects height in children and may also affect other parts of the body, like bone, muscle, and fat in children and adults. In a child, this disorder is called pediatric growth hormone deficiency, and in an adult, it is known as adult growth hormone deficiency. Growth hormone therapy may be required to address this deficiency throughout different stages of life. Pediatric growth hormone deficiency. Pediatric growth hormone deficiency may occur at any time during infancy, childhood, or adolescence. A major sign of pediatric growth hormone deficiency is a marked slowing of growth. This slowdown is usually greater in infants and adolescents. While pediatric growth hormone deficiency is uncommon, there are several reasons why it may be present. Growth hormone deficiency may occur if the pituitary gland or the hypothalamus, a part of the brain that controls the pituitary, has been affected. In this case, other hormones from the pituitary may also be deficient. Sometimes the reason for the growth hormone deficiency may not be discovered. In other cases, growth hormone deficiency may be the result of a genetic deficiency, and more than one child in a family could have it. Other pituitary hormones, in addition to growth hormone, may be deficient. Finally, in some children, the body may need more growth hormone because their body doesn't use the growth hormone they have properly. For example, Turner syndrome is a genetic disorder affecting only girls that is characterized by short stature and ovarian dysfunction. Girls diagnosed with Turner syndrome usually require growth hormone therapy to help them reach a more normal height. Another example is chronic renal insufficiency, or CRI, a condition in which the kidneys gradually lose their ability to perform their normal functions, such as the removal of wastes and extra fluid from the body. Children with CRI may have difficulty attaining a normal height and weight for several reasons, including slow bone growth. Bones become longer when the soft cartilage cells from the growth plate or epiphysis get bigger and turn into hard bone on each end. Growth hormone is one of the messengers that tells the soft cartilage when to grow. When the bone is completely grown, the end of the bones harden and fuse to the main bone shaft. This results in linear growth until the growth plates fuse at the end of puberty. Growth hormone also helps bones grow stronger by increasing bone mineral density. In addition to stimulating bone growth hormone influences the growth of internal organs of the body, so they remain in balance with the skeletal growth. Growth hormone also works with the other male and female hormones during puberty to permit a growth spurt and normal body composition. Adult growth hormone deficiency. Growth hormone deficiency can develop in adults when the pituitary gland does not secrete enough growth hormone. The causes of adult growth hormone deficiency include pituitary disease, hypothalamic disease, tumors, some brain surgery, radiation therapy to the head or neck, or head trauma. In many of these cases, other hormones from the pituitary may also be deficient, and these patients are said to have multiple pituitary deficiencies, or panhypopituitarism. There are also some patients who develop growth hormone deficiency as adults without an obvious cause. Generally, these adults are divided into two groups. The first group is childhood onset patients, or those who were deficient as children and continue to be growth hormone deficient as adults. Not all children with growth hormone deficiency will later become growth hormone deficient adults. Children with growth hormone deficiency should be reevaluated as adults to see if the condition has persisted into adulthood. The second group consists of adult-onset patients, or those who acquire growth hormone deficiency as adults. Adults with growth hormone deficiency often experience subtle symptoms like low energy levels and fatigue, decreased sense of well-being, and increased social isolation. Metabolic changes caused by adult growth hormone deficiency can result in increased body fat, decreased muscle mass, elevated cholesterol levels, decreased bone density, and decreased insulin sensitivity. These changes may contribute to increased cardiovascular risk. Benefits of growth hormone therapy. Growth hormone therapy can benefit people diagnosed with growth hormone deficiency or diagnosed with conditions in which their bodies do not utilize the growth hormone they're producing normally. In some patients, growth hormone therapy triggers the breakdown of fat, which leads to increased lean body mass and an improved ratio of bad to good cholesterol. In both childhood onset and adult onset patients, growth hormone therapy has been shown to help in these areas. The amount of growth hormone you need changes throughout your life. Children need more growth hormone than adults, while teenagers need more growth hormone than at any other stage in life. Childhood onset growth hormone deficient adolescents should be retested for growth hormone deficiency as they move into adulthood. Some of these individuals may need to continue their growth hormone therapy. This period of time is often called the transition period. Doctors perform diagnostic tests to evaluate growth because of risk for growth hormone deficiency. If growth hormone therapy is needed, a doctor will prescribe the proper dosage and delivery mechanism. You should consult with your physician about the benefits and risks of growth hormone therapy. Please refer to important safety information and indications on the main menu of this program.